Hello and good morning, dear viewers. You're most welcome to the health episode of the DAKTARI program, which you see on National TV every Thursday from 11 a.m. to noon. And I'm always your host, Sande Junior Tom. Today, we are delighted to have another guest who is going to take us through eye challenges or eye problems a viewer could be there facing in the community. However, also would love to congratulate our Azam family who have come on board, and those who are in your living rooms and those who are maybe in your workplaces. Thanks for coming up. Before we go to our topic, let's first get our guest to introduce himself, then we pick on. You're most welcome to the DAKTARI episode. You introduce yourself, sir.
My name is Benjamin Lokiria, so you can just call me Dr. Benjamin. I'm an optometrist working with MedOptics Vision Center. So an optometrist is basically just an eye doctor. Let's put it as an eye doctor who is able to handle all your eye care needs. MedOptics is basically an eye clinic. We are based here in Arua City, opposite Bank of Africa. Yes.
All right. Thank you very much, Dr. Benjamin, and also MedOptics Clinical Vision Center. We don't take it for granted, giving in their personnel, the eye doctor, let's call him like that, Dr. Benjamin, to come and educate the viewers regarding matters of their eye health. Let's pick on from our topic of discussion. Today we are going to look into 3 different challenges which could be affecting your eyes. That's a glaucoma, that's cataract, and also night blindness. However, we would love the eye doctor or Dr. Benjamin to discuss for us, then to educate us, the viewer, and also the viewers, such that we get to understand all this. However, we are going to look at them one at a point, and we shall start with glaucoma. Doctor, we would love to know, what is a glaucoma? Because people in the community may not know what glaucoma is, because these words are complex for them to understand.
Glaucoma is basically a group of eye conditions that cause death or damage to the optic nerve. So the optic nerve is basically the wire, I want to call it a wire, that connects the eye to the brain. So if I just have a demonstration here, so you can see in this, this is your eye, this is a cross section of your eye. So the back of the eye is here, so the optic nerve is this wire here. I'm assuming the brain is somewhere here. So this wire which connects the eye to the brain, that's the optic nerve. So this is the part which is affected by glaucoma.
Hope the viewers have gotten to understand that it's all about your nerve, optical nerve, or the wire which connects the eye to the brain getting damage. Then we would love to know from you, Dr. Benjamin, what are some of the things the community members in the community outside there in the societies which they could be doing, which could put them at risk of getting this eye problem?
The major risk factor, of course, is increased pressure in the eye. That is the biggest risk factor. Though there are cases where even if the pressure is normal, you still have glaucoma happening. So there are other factors that can lead to it as well. So basically, older individuals, 55 years and above, there is an increased risk of glaucoma. Being Black African and Asians as well, I think Hispanics as well, yes, those are also at high risk. People with other general body conditions, say diabetes, blood pressure, those are, and also sickle cell anemia, those are also conditions that predispose people to glaucoma. Also, people who have medications that they use usually, most especially steroids. Steroids are also a very common cause of increased eye pressure, which of course I've already mentioned may lead to glaucoma. So those are some of the risk factors.
I hope the viewers have gotten to, in case you are advancing in age, and also you said if you are an African, so it means everyone is at risk of getting a glaucoma. Hope the viewers have gotten to note that. However, we would love to know from you, Dr. Benjamin, before we go to the causes of this glaucoma, this eye problem which affects the nerve or the wire which connects the eye to the brain. Is this thing very serious? Because someone can be with such a condition. We have seen people in the community with some health conditions which are mild, and someone can live with them without seeking care in their hospitals. Is it this condition also very serious?
So glaucoma is one of the most serious conditions, actually, if we are grading seriousness in terms of eye conditions. Because ultimately, if it's not managed, you're going to go blind, as in blind. So it's among the top causes of blindness in the world.
You have scared me off by saying the how serious it is someone can lose their sight. So I believe even the viewers also there, you have gotten to know that today's topic is something in necessity we should give key attention to and get to learn from this eye doctor who will help us know how we can prevent. Because we have seen people in the communities go blind without clear reasons. Some say it's maybe bewitching, and yet you never know it could be maybe having this having glaucoma, which affects your optical nerve. Then also would love to know from you, Dr. Benjamin, what are maybe the specific causes in the maybe it could be in the communities, maybe relating to the individual, which could cause this glaucoma.
As far as causes go, glaucoma as a disease a group of conditions, research has not yet established exactly what causes it. So as far as causes go, the closest risk factor or the most common risk factor you'll have is increased eye pressure. So that is the commonest that is associated with it. But like I said before, it can also occur under normal eye pressure conditions. So risk factors are the biggest thing that we are going to talk about there.
Hope our viewers have gotten to know it all rotates about the risk factors which could push you to get this eye challenge or problem. Then we would love to know from you, Dr. Benjamin, what are some of the presentations a member or a viewer in the community could get which could maybe indicate that they are having this eye problem, which is the glaucoma?
The biggest challenge with glaucoma usually is that it's insidious. That means that it doesn't have any signs or symptoms in the early stages. So that presents a very specific challenge to both the patients and us, the eye care professionals, because now it's hard to tell. It's not like you can get a headache or something that tells you that you have glaucoma. So in the early stages, usually there are no signs or symptoms, but then as it progresses, then you'll notice that you have lost your peripheral vision. Peripheral vision is that vision, what you see on the sides. For example, when I'm looking into the camera, I'm still able to see other things on my side. So that's my peripheral vision, where my hands are now, because I can still see them. So with glaucoma, when it advances, if I'm looking straight, I'm not able to see where my hands are here. So that's loss of my peripheral vision. Then eventually, I will also lose the central vision now. That is now when blindness comes in, if it is not treated or managed. So that is the most common presentation.
I hope our viewers have gotten to know that in case they are aging or maybe you're an adult, you're also an African, and you happen to get those loss of vision, please, you can go out to the nearby optometrist and they help you out. Then also would love to know from you, Dr. Benjamin, someone has gotten such an issue or challenge at home or in the communities and they are no longer having proper vision. What could be their other next steps?
The most important thing you need to do is really come and see an eye doctor. You can come to me, an optometrist. You can visit an ophthalmologist. Those are really the people who can make the diagnosis. Because even the other general doctors may not make that diagnosis well. So you need to see an eye care specialist, basically. So that is the first step you have to do, and you have to do that regularly. If, of course, you have the other risk factors. Are you older than 60 or 55? Are you an African? Do you have hypertension? Do you have diabetes? Are you using steroids? So when I do have a family history. Actually, that is one of the risk factors, family history. If somebody has gone blind before due to glaucoma in your family, be it an uncle, be it a parent, then that means you have a family history of this condition. Then you should also now try to have your eyes regularly checked, because like I said, this is a silent thief of sight. So that means you may not know you have it until the later stages.
In case you have a family member who has maybe a similar challenge or they had a similar challenge, please, you're also at risk of getting this issue. Then also would love to know from you, Dr. Benjamin. We have a patient, let's assume, they had this challenge in vision and they have come out to you maybe in your eye clinic, maybe they've gone to MedOptics. How do you guys always test to confirm maybe it's the glaucoma which is causing this loss of vision? Thank you.
We have what we call diagnostic tests. The first step, of course, is we assess your vision. We assess how well you see. But that is not enough. So we also go ahead and now assess the optic nerve, that way I talked about. We have to assess it. So, and also we have to measure the pressure of the eye. Remember I said the eye pressure is the biggest risk factor. So we measure the pressure of the eye using the machines we have here. We do assess your vision to see how well you're seeing. We also assess now how wide your vision is. Remember I said you can lose peripheral vision in this case. So that is testing your visual field. So we assess your vision, your visual field, we test your pressure of the eye, and then we check the nerve behind there to come up with a diagnosis.
However, we would love you to give us a feel of how do you always test to see this wire which connects the eye and the brain.
You see, there's this machine here. This is called a slit lamp. So this machine is basically what we call it's like a magnifier. It helps us to be able to see more of the eye. But then we also have another lens which we attach to that machine to help us to see past inside the eye there. So if I can just demonstrate this here. So this is your eye, like I said before. So this presents a challenge because now this wire is behind here, and yet I'm looking, when you're seated on that machine, I'm looking at the front structures here. So there is another lens which I have to put in front of you here to put in focus this. But now the window through which I look through here is very small. So the eye drops which I put to enlarge, what we call dilate your eye, to allow me to give me a wide enough window to focus on this wire here. So I have to dilate your eye using an eye drop, and then I am able to focus behind here to see well this nerve and the other parts as well behind there. So that is how we go about looking at your nerve.
I believe the viewers have gotten a feel of how they always test through your eye from the front up to the back using the slit lamp. Then we would love to know from you, Dr. Benjamin. You have done your tests, you have confirmed someone is having glaucoma, which is affecting their peripheral vision, like they can't see things by the sides. How do you always manage such patients?
Management of glaucoma is majorly, the most common form of management is using eye drops. So the eye drops are aimed at reducing the pressure of the eye. I'll keep saying this, the pressure is the biggest risk factor. So in cases where the pressure is high and is leading to the glaucoma, then we have to put eye drops there to reduce that pressure in the eye. So the eye drops are the mainstay in the management of glaucoma. There are different eye drops, different classes. And can't go into too much detail there, but yes, when you are there, then we shall be able to. The other form of management also is surgery. So surgery is also still aimed at reducing the pressure of the eye, but also they create channels in your eye to drain that fluid to reduce the pressure inside the eye. So both can be done concurrently or one other than the other, depending on what the doctor has seen there and recommended.
Thank you very much, Dr. Benjamin, for that detailed discussion on how you guys always manage people with such eye challenges. However, we would love to know from you, how can a viewer in the community protect themselves from getting such a challenge? Because we have seen it leading to loss of the peripheral vision sites, like someone can't see objects or things by their sights. How can the community members and the viewers of Arsenal TV protect themselves from getting these eye challenges and complications?
The biggest weapon you have against this is really regular eye examinations. So you want to check your eyes regularly. Of course, the older you are, the more regularly you should do it. So for older individuals, usually we advise you at least once every 12 months. That's once a year. You go and check your eyes. Come check your eyes. We assess and we give you that bill of vision. So okay, everything is good. Or if there is this, there is that. We can then proceed from there and see how to manage. The other way you can prevent this is, of course, if the diagnosis has already been made, then you want to make sure you're taking your medications as prescribed by the doctor. And also, if you have other conditions that we have already talked about, for example, those with diabetes, those with sickle cell anemia, those with blood pressure, you want to make sure those conditions are under control. So you want to keep your other systems in check and make sure your health is good, so that now, because they can lead to these other conditions. So it's important to have those in mind. Yes.
However, you told us in the risk factors that someone being like having an aging like is one of the risk factors, and also being an African is one of the risk factors that they can get this glaucoma. We would love to know, at what right age should someone start to get worried and start going for these regular eye checkups?
glaucoma doesn't usually segregate. It can affect even children. Sometimes even children are born with glaucoma. Sometimes they get it in the very, very early stages. So that means still regular eye checkups are okay for all age groups, but more importantly, when you grow older, you need to do them more regularly. Yes.
We see people whenever they come to the eye clinics, they often give them glasses. Some call them reading glasses. We would love to know, also in this particular condition of glaucoma, after you guys have given the management to the patients, do you also give reading glasses to these patients?
Uh, Reading glasses are an independent case here because now glaucoma is more like a disease in itself. Usually, glasses are given to help aid your vision, to help you to see more clearly. So, glaucoma it can occur with the other. For example, you can be short-sighted and also have glaucoma. So, if you're not seeing things very well and also have glaucoma, yes, we shall manage your glaucoma, but we shall also give you glasses to help you improve your vision if the glasses can improve your vision. Of course, there are what we call protective glasses as well, because there are some cases of glaucoma where they are due to trauma. So, for example, if there is an injury to your eye which can lead to glaucoma, we want to prevent such cases. So, if you're somebody whose work is, for example, risky, say you're a welder, say you're a construction worker, and you need those protective eyewear, we do give those protective eyewear, even if you don't have glaucoma, to help protect your eyes from getting the glaucoma in the first place.
Without any eye challenge, these people have to put on eyeglasses. Thank you very much for that clarification. I would also would love to know, in case someone got this symptom, maybe they can't see, they lost their peripheral vision, in other words, like they can't see objects by their sides, and they remain reluctant at home and they don't reach out to the eye clinic to seek care. What are some of the complications or advanced challenges these people may face?
If it's not managed, if it's not attended to, you're going to go blind. So that is as simply as I can put it.
I hope our viewers have gotten that. In case you get this challenge and you remain reluctant at home, please, you could completely lose your vision. And I think the eyes, they are organs which we need on the body because you can't move or do anything guided very well without sight. Then also we are going to transition to another topic of discussion. It's still regarding to eye challenges, and this one is called a cataract. We would love to know from you, Dr. Benjamin, what's a cataract? Because also viewers may need to understand it because your words, you guys, you use complex, you are using glaucoma, you are using cataract. What's a cataract for this case?
Cataract is basically clouding of the lens of the eye. So again, I will go to this chart of mine. It's really very, very helpful. So this is your eye again. This is the front, that is the back. So when I talk about the lens of the eye, I'm basically talking about this white structure here. This is the lens of the eye. So as you can see, it's sitting behind this black part of the eye. This is the iris, so the lens is there. So this lens is supposed to be clear, but then in cataract, it becomes cloudy. So that is what we call cataract, basically.
A viewer may need to know you're talking about cloudiness of the lens. What is the lens itself, and what are some of the roles it plays?
The lens of the eye is basically what helps to focus images, to make them clear. So without the lens, you will not be seeing things as crystal sharp as they should be. So the lens helps to put things clearly in focus, both at far and at near. So it's that lens that is responsible for making sure you're able to see things which are far, you're able to see things which are near, because the powers required for seeing these things far and near are different. So the lens, because it's flexible, it is able to adjust its powers to be able to focus on things at all distances and make sure you're always seeing things crystal clear.
And hope our viewers have gotten to know we need the lens for focusing, such that we can see these images and objects very well and clear. Then also would love to know from you, Dr. Benjamin, what are some of the things the viewers could be doing which could predispose them to get this lens cloudiness of the eye?
In most cases, really, in terms of cataract or cloudiness of the lens, the person or the patient is really innocent. In most cases, it's age-related. So it comes because you're growing older, and and the proteins in the lens are now breaking down, so it becomes harder and then it becomes cloudy. So it's really, that is the biggest risk factor there, that is age. But then there are other cases as well. Smoking, that is something which can cause it. Again, diabetes, hypertension, those ones are also factors here. Still, again, steroids, I come back to steroids. Steroid medications, those ones are also implicated here. Injuries to the eye, penetrating injuries to the eye can lead to cataract as well.
When we are talking about glaucoma, you scared us of that. If a mere fact, us being Africans, we can get the glaucoma. We would love to know also, is a cataract related to race, that someone also being an African could be at risk of getting this eye challenge?
Cataract, in the sense, like I said, most of it is age related. Of course, it can occur to people in all age groups, even children can get it, some children can be born with it. But in this case, race is not a very specific risk factor.
We would also love to know from you, how can someone in the community or a viewer start to notify that, or maybe the indicators that they're having a cataract?
The biggest sign that you have a cataract is your vision becomes cloudy. I want you to imagine looking through a foggy window or looking through smoke, So that is essentially what it means for somebody to have cataract. So that is the biggest sign that you may be having cataract. That is usually in the later stages. Your vision becomes smoky or hazy. But in the early stages, your vision might be okay. Of course, other factors constant, because there are other causes, other things which may make your vision not clear. But in case everything else is okay, in the early stages, you may have what we call light sensitivity or photosensitivity and glare. So what that means is that, for example, for those who drive, if you're driving at night, that light coming from oncoming traffic, you feel like it really disables your vision. So that is you being sensitive to the light and experiencing what we call glare. So that is the biggest sign of cataract there.
I hope the viewers have gotten to understand that this cataract is all about, like, you are seeing through. Actually, you also have this morning dew sometimes, like in case you have such a vision, like you feel it's very cloudy, that could be a sign or a symptom that you have a cataract. We would also love to get some remarks from you, Doctor, before we come to the conclusion of the first segment. What could be the next steps a viewer can do in case they have this foggy vision, like they can't see very well, their vision is smoky, like as they are trying to focus on objects? What could be their next step to do?
In this case, again, the best thing you can do for yourself, for your eyes, is come see us, come see an optometrist, come see an ophthalmologist. We'll be able to perform some of the tests again and be able to make the diagnosis that you have a cataract.
Let's first break off for a short breather, and we'll be back in the next segment where Dr. Benjamin, the eye doctor, will take us through then tests they always do to confirm that you have this smoky vision or a cataract. Thank you. Let's get back.
West Nile TV, lighting up the region. Subscribe for 3 months to any package of your choice, or grab an Azam TV kit and pay for 3 months and stand a chance to win life-changing rewards: Android smart TVs, fridges, motorcycles, and that is not all. You could walk away with free subscription or the grand prize of 20 million Ugandan shillings in cash. Yes, 20 million grand prize. Subscribe today and enter the draw. For more information, 031 2308 900 or visit any Azam TV dealer near you.
Azam TV, entertainment for everybody.
Mbappe! Jude Bellingham, Vinicius Jr., Lamine Yamal, Antoine Griezmann. La Liga comes to Star Times.
A wild celebration!
The big stars, the tiki-taka football, Real Madrid and Barcelona live in your living room.
Real Madrid, a team of dreams!
Catch all 380 games live and in HD on Sports Premium, Channel 259 and Channel 246. Starting this August 15th. Subscribe to StarTimes Classic or Smart Bouquet at 36,000 Uganda shillings to enjoy the football experience affordably. StarTimes Football and limited passion.
In the dance of shadows and light lies the heart of Uganda's resilience amidst the challenges of the night, where innovation meets necessity and education refuses to be dimmed, where connection thrives in the absence of power. Embrace the power of the sun with StarTimes solar range of solutions and empower your journey towards a brighter tomorrow. StarTimes Solar. Power your life.
West Nile TV, lighting up the region.
We'll be back, dear viewers, from that short commercial break. I'm still Sunday Junior Tom, your host for the DAKTARI program. And those who have just joined in today, we have been delighted to have Dr. Benjamin, an eye doctor from Med Optical Center, who has come up in the first segment, and we discussed matters regarding eye challenges. Specifically, we looked into what we call glaucoma, which he says it's just damage to the optical nerve, which we could say like the wire which connects your eye and your brain. And he told us that this could lead to eye blindness. Then also he talked about a cataract. All these words is using a complex, but however, he told us a cataract is just having cloudiness, like when you can't see very well, you see like smoke in your vision, you can't have clear vision. So that was a cataract. Then also we break off when he was going to take up through the confirmatory tests they do in the eye clinic to confirm that you have this cataract or smoke vision. We'll be back from that short commercial break, Dr. Benjamin. We would love to know what are some of the tests you guys always do to confirm that maybe a client or a patient has a cataract.
Well, regarding cataract, because it affects your vision, when you walk in, of course, I'm going to first assess how well you're seeing. So I'll measure something we call visual acuity. That's basically measuring how well you're able to see. So you see that chart behind me, that is, so I'll tell you to read those letters. When you read those letters, as you can see, the sizes are reducing. So the more you can read, the better I know your vision is. So people who have cataract, they may fail to read some of those smaller ones. And also, in case they are reading them, they may say they are a little white, they are whitish or they're hazy. So that can also be a clue for me to know you may be having cataract. The other tests we do, of course, after that, we are going to assess also using this machine here, the slit lamp. It's one of our most important instruments here. So the slit lamp now will enable me to assess the lens of your eye to check how well it is. And also that will also help me to look for the location of the cataract, the size of the cataract, and also grade it such that I can make a very, very good report on it, because I myself, I don't manage it. When it comes to management, I have to make a referral. So, because I'm an optometrist, I'm not trained for that. So what I can do is make the diagnosis. So to make that diagnosis, I have to now assess all those facts there. Where is it located? What is its size? And to what extent is the vision affected? So that helps me to make the referral properly.
Papa viewers have gotten to know these tests they always do for your eyes. And I know those who always watch this health episode, you always know that smells chat, because we have ever had an optometrist also here ever to discuss for us matters regarding your eye or vision challenges. Also, would love to know from you, Dr. Benjamin, which management or care do you always give to people in case you confirm that they have this smoky vision, which you call a cataract?
The mainstay for cataract management or treatment is really surgery. So surgery basically, it's what we call cataract extraction surgery. So that one is where they now have to remove this lens which is now cloudy. They have to remove this lens which is now not seeing well, and replace it with an artificial lens. Now, of course, I know when we say surgery, usually people get very scared. So this is a very simple surgery. So like I said, I don't do it myself. So usually when I get people with cataract, I refer them to an ophthalmologist. That is now somebody who is above me. That's an eye surgeon, that's an eye specialist that does these surgeries, of course, plus other multitude of surgeries and management as well. But when it comes to doing this cataract surgery, it's a very simple, short surgery. If it's done very, very well without any complications, usually even less than 30 minutes, it's a done deal for the eye. So that is how simple it is. So you don't be scared.
You said we shouldn't be scared, but you scared me off. I'm imagining how you guys will cut open someone's eye, like to remove this lens. It's scary a bit. However, I would love to know, for this condition, do you guys give maybe reading glasses? Because in the first condition, you said it's not a necessity to give out reading glasses. But in this case, do you give out reading glasses? And also, another concern, you told us they always remove this lens, right?
Yes.
We would love to know, how will now these eyes focus? Because you told us one of the role, or maybe the use of this eye lens is to focus maybe these light rays from objects onto the retina such that they can be taken to the brain to be interpreted. What next do you always do for such patients after removing these lenses?
That's how usually we do what we call co-management with the ophthalmology team. So I'm going to give a scenario. Let's say a patient has come in, this 65-year-old patient, they have a cataract. Of course, they're going to say, I'm not seeing things very clearly, things appear hazy, blurry. So then, of course, I'll do my tests, I'll confirm, okay, they have a cataract. Now, there are cases where somebody has a cataract, but their vision still improves when I give glasses. So in some cases, I'm going to give the glasses first, and then eventually I'll tell them, now we have to keep reviewing this thing because it's going to keep getting worse. So as we go on, I'll give you the glasses, but I'll tell you, we have to keep on assessing this. So after every 6 months or 1 year, depending on which timeline I've agreed with you. So we have to do that. And then the other case is a case where even now the cataract is mature and it's not improving even when I give glasses. So that's a case probably where I'm going to refer to an ophthalmologist where the surgery will be done. Now, when this surgery is done, they're going to remove that lens, which is not okay, and then they will replace it with an artificial lens. Now, the challenge with the artificial lens is that it cannot perform all the roles the other natural lens was performing. For example, focusing things which are up close. So usually after this surgery, that person, of course, is going to have a recovery period of about 5-6 weeks, and then they will come back to me, now the optometrist. I will then do what we call post-surgical refraction, where again, I will assess their eyes for glasses. Basically, glasses mostly to help them read near things very well, but sometimes also to help them keep far things in focus. So yes, in this case, after surgery, most likely, and most cases, actually in all cases, we have to give the person reading glasses to help them see things clearly.
I hope the viewers have gotten to understand. For this scenario, we shall need, or maybe the eye doctor will give you reading glasses for you in order to focus these ways for proper focusing and reading when of books, maybe reading your Bible. Also, we would love to get a clarification from you, Dr. Benjamin. Often people in the community, when they get this smoky vision, they attribute it to witchcraft. What is some of the measures or cares you could give to them? And also wrap it up with the preventive measures or care that the viewers could do to protect themselves from this cataract.
Regardless of what the cause of your blurry vision is, could be cataract, could be a refractive error, it could be, or it could be an infection, could be anything which is affecting the eyes. The biggest advice I'll always give is come and see the eye doctor, come and see the specialist, because things to do with the eyes are really very sensitive. You don't want somebody messing around and poking around your eye when they don't know what they're doing. So the first thing I'll tell you is come and see the doctor. We shall make the assessment and then we shall advise you accordingly. The other thing, of course, now would be other preventative measures. Okay? Things like I said, smoking is a risk factor. If you can, please don't smoke. The other thing I mentioned is pressure or diabetes. Now, those ones can also, if you see that your pressure is high or your sugar is uncontrolled, you go ahead and visit a general doctor and he'll be able to give you medications or otherwise to be able to bring down this pressure or sugar. So you basically have to manage other contributing factors as well as managing your own factors. So if you have been told that, okay, this could be due to the steroids you're taking, because I already mentioned steroids are a risk factor, then you need to find alternative measures or alternative ways of managing whatever those steroids are managing so that you can cut down on the steroids to prevent this from going on.
I hope our viewers have gotten to know on how you can keep yourself and prevent this smoky vision, or what we call a cataract. Keep to note, if you have diabetes or hypertension, please try to regulate those parameters in your body. And also would love to know from you, Dr. Benjamin, in case someone at home got a smoky vision and they also remained reluctant and they did seek care from the eye clinic or from maybe the eye doctor, what are some of the complications which may advance for such people?
Well, basically with cataract, it's not as scary as the glaucoma, but still you're going to basically go blind. The only difference with this is that we may be able to reverse it with the surgery. Of course, that I'm talking about the ophthalmologist. But again, you don't have to take that for granted. Usually when the cataract becomes too mature, so that it then can lead to more complications. So the longer you take without doing the surgery, the higher the risk of getting complications during or after this surgery. Sometimes, if the thing is really too mature, they may tell you, no, this one, we cannot even operate on this one, depending on, of course, your age and other factors in the eye. So the earlier you get the surgery, the better usually, and the easier and the more responsive your eye is going to be to the surgery. So yeah, that's basically it.
Please, you have always to seek care immediately you get any of these challenges. However, I would love to know from you, and also maybe to clarify for the viewers, you have told us both glaucoma and cataract are age-related. Which of these two is more common in adults, as you have been attending to these patients in your clinic?
Thank you. Well, in terms of which is more common, that would be cataract. Cataract, even worldwide, it's one of the most common causes of blindness. Only difference is this is something reversible. So it's really sad knowing that your grandpa, your father is out there, he's struggling, he can't see well, yet it could be something which can be addressed or which can be reversed. So you really want to bring these people for checkup. If your father is there complaining about not seeing well, things are blurry, or everything is looking yellowish, that is also one of the signs of glaucoma, cataract. You want to bring him in. We take the measurements, we check him very well, and then we see how to manage the condition. So yes, that is that.
There's one thing I've picked from that conversation. You talked of a cataract being reversible. Are there some eye problems which cannot be reversed? In other words, when maybe a viewer gets the eye challenge, like it just advances, it can't get back or maybe be corrected.
We have already talked about one of them. Glaucoma is irreversible. Once the damage has happened, it has happened. All we can do is slow down the progression or stop the progression. But if we catch you when 50% of the vision is gone, that 50% is gone. So all we can do is try to preserve the remaining vision. So that's usually the goal of management in cases of like glaucoma, because essentially, like we said, there is damage to the nerve. Now, nerves are tissues which rarely regenerate, and in this case, this one is not going to regenerate. So that means once damage is done, it's done. So this one is what has happened has happened. So basically, what we do is try to preserve the remaining vision. So that goes ahead still to tell you how important it is that we capture these things as early as possible, which speaks to you to be able to come and check your eyes more regularly, because like I said, glaucoma being one of those that is irreversible and some very, very, very common in our population. If we can catch it early, then we can stop the damage or slow it down. So you want to come in and we'll be able to do the tests that are necessary to try and detect it.
I hope the viewers also have gotten to understand and they have picked a lot of information in regards to their eyes regarding cataract or the smoky vision, and also glaucoma, which is affecting the wire connecting your eye to your brain. However, also we're going to transition into another common eye challenge which affects people, which is called night blindness. We have often seen people in the community, they are told you have night blindness, and they can't explain what it is and how they could have gotten it. Again today, still in the same session, Dr. Benjamin is going to take us through what night blindness feels like. We would love to know from you, Doctor, what's night blindness?
So, night blindness, I don't want us to look at it as a disease. Night blindness is more like a symptom. It's like how you say, I have headache. Headache is not a disease. It's simply a symptom or a sign that something else is wrong. Okay? So night blindness in this case means that you're not seeing well at night. Now, what is there at night? At night, there is dim light or there is no light. There is darkness. So that means your eyes are not adapting properly to low light conditions or darkness. Because even in the darkness, we should be able to perceive some things. So there are cells in our eyes that are specialized to be able to detect things and help us at least see in dim conditions or low light conditions. So when those cells are affected, or when something is preventing that light from reaching the back of the eye or the retina to capture that small light which is there, that leads us to have poor vision in those low light conditions, and hence somebody will tell you have night blindness.
I hope our viewers have gotten to understand. In case you have reduced vision in these dim light maybe rooms, that could be what we call night blindness. However, Dr. Benjamin, you talked about the cells. Are there cells specific for sight in the dim light, and also are there other cells specific for sight when maybe there is bright light?
So yes, broadly speaking, yes. In the eye we have two types of cells. We have those that are responsible for daylight vision or daytime vision, and then those that are responsible for nighttime vision. That is broadly speaking. Of course, there are other details there that we are not going to cover in this short session. So that means now if those cells are affected, the ones which are responsible for night vision or seeing in low light conditions, then you may be able to experience this.
What are some of the causes or things which affect these cells responsible for vision in the dim lights, which could now progress because of this night blindness?
Glaucoma can be one of those cases where you have those cells damaged at the back of the retina, whereby, yes, of course, these cells will be damaged, but of course, glaucoma is not selective that much. So these cells will be part of the damage in terms of the damage to the back of the eye, and it's actually the optic nerve. So that's one of the conditions whereby these cells may be affected. The other issue which usually causes this night blindness, which is actually the very, very, very common issue, is vitamin A deficiency. So the vitamin A is very important when it comes to the pigments or the cells that help us in this night vision. So when we have issues with vitamin A, be it malnutrition due to lack of the vitamin A in our diet, or our body failing to take up the vitamin A due to certain factors in our stomach or our intestines, then we are going to have trouble with night blindness, because now these cells are not functioning as they should, as they don't have the pigments to pick up this light in the dark light condition. So those are some of the conditions there. Now, there is also the issue of cataract. Now remember I said, yes, these cells may be the problem, but sometimes these cells are okay, but light is not reaching there. Now remember where we said the cataract is. The cataract is like the clouding of that lens. Now that lens is what helps to focus things there. So if, let me just demonstrate this here. So if we have, this is where the position of the lens, and this is where those cells which help to focus the light are on the retina. So if this is cloudy and is obstructing light, that means when the light is coming, it doesn't go past this and it can't reach where it's supposed to reach. Now imagine a scenario where even there is little light already. So that means even that little light is not passing through this. So that means in cases of cataract, you're going to end up again with night blindness.
I hope our viewers have gotten to know of the things which affect your vision, like in case it's a cataract or glaucoma and they can't let light reach your back of the eye, you could be getting night blindness. However, I would love to know from you, Dr. Isaac, is it like a presentation? Is it they already are perceiving it that someone, in case they have night blindness, like they can't see in the night, or the other presentations someone could get with this eye challenge?
It's just as it sounds. Night blindness simply means your vision is reduced when you are in when it is dark or when it is night time. So I'm going to give you a scenario whereby I'm assuming, let's say this room is dark and outside there is sunlight. So when you say night blindness, it doesn't mean it only comes at night. In any scenario where you're moving from a bright situation, let's say from outside and indoors into a dark room, and you have this issue, you're going to experience poor vision. You're not going to see things very well. So if there's a chair on your way, you may not see it, you end up knocking it. If there is something on your way, somebody in the house, you may not be able to see them as long as it's dark. Be it daytime, be it nighttime, as long as you have dim light conditions, you're going to have trouble seeing if you have night blindness.
Hope our viewers are going to note that. Also, however, I would love to know from you, in case someone has gotten this challenge, like they can't see very well in dim light, what could be their next steps they could do in regards to their eye challenge?
Again, the constant here really is, first things first, come and we check those eyes. Visit the optometrist, visit me here, visit an ophthalmologist, go check the eyes. Now, when we check your eyes, we shall be able to determine, both from your history, of course, what we ask you about your medical history, and also from the assessment we make here using these machines, we shall be able to tell what is causing the night blindness. So once we tell what is causing it, and then we shall be able to address the situation. As you know, every problem, if you don't know what is causing it, you're not going to be able to address it. So the first thing is find out what is causing it, and the only way to find that out is to come and see an eye doctor.
However, briefly take us through, how do you always confirm, or at least you guys always do to confirm that a patient has night blindness?
Like I said, night blindness is a symptom. So that means that is what they are going to present with. Okay, so the patient is going to walk in here and say, you know what, doctor, every time I'm moving in the night, I end up falling. I'm not seeing things well. Every time I enter a dark room, I first have to sit for a very long time before I can even see anything because I cannot adjust. Or I have to wait for somebody to turn on the light so that I can move in the house. Every time I am moving in the dark condition, I cannot see. So that is a symptom. That is what they're going to present with. Now it is up to me to then ask them more questions, okay? Is there anybody else in the family with this? How is your diet? Where do you come from? Because sometimes there are some places where people are prone to lacking vitamin A, or some settlements. For example, some people maybe somebody's in a refugee camp where they're not feeding properly, so I might be suspecting malnutrition in this case, where they don't have vitamin A in their diet. So that, because we already talked about vitamin A in relation to this, then I'll also be able to now assess, of course, I'll see, is there a cataract from this? Is there, sometimes some people, when they are short-sightedness also, sometimes actually people who are short-sighted have poor vision in dark conditions or at night. So their vision is worse. So again, I'll be able to assess and see whether they're short-sighted or not. Again, I will see, okay, does this person have glaucoma? Do they have cataract? Are those cells in the retina okay? Because again, I'm able to perform those tests using these machines. So that is just a presentation. The person is going to come and say, I don't see well at night, I don't see well in the darkness. Then I'm able to do all this variety of tests and determine what is causing that, and then I should be able to get to the bottom of this issue.
Half our viewers have gotten a feel of how these tests are always done. However, I would love to know, which management do you always give to patients with night blindness? Are you going to get torches and start giving them to use at night, or which other specialty management do you always give them?
It's interesting. So, well, we don't give torches. That's a potential solution. But, like I said, this is a symptom. So, we have to get to the cause. What is causing this? First and foremost, if there is a cataract, then I'll refer and say, okay, go to the ophthalmologist. You need an operation to remove the cataract so that your vision can come back to normal. If there is glaucoma, again, we are going to start you on management for glaucoma. If you have vitamin A deficiency, same thing. We are going to now put what we call now vitamin supplements in your diet to help you to get back to your vitamin A levels, and then eventually your eyes come back to normal.
Now you have taken us through how you always manage these patients. You took it to the cause of the challenge or the problem. However, I would love to know, how can someone in the community protect themselves against night blindness? You talked about vitamin A deficiency. What are some of the foods which could give vitamin A to the viewer such that they can start taking such foods?
Common vegetables, our very own, what we have, the green leafy vegetables, the peanuts, the beans, all these, the carrots, these colored foods, the tomatoes and all that, they all have, of course, other vitamins as well. So those are the foods which are going to give you this. So basically, one of the things you want to do here is make sure you're eating healthy. You know, have that balanced diet. Eat that meat, eat those carrots, eat those vegetables, eat well, eat that fish. Those are the foods which are going to give you these vitamins.
All right, thank you very much, Dr. Benjamin. As we come to the conclusion of the program, what are some of the complications a viewer could get in case also they remain reluctant in seeking care in regards to night blindness?
We have already seen that this night blindness is basically just a symptom. It's just telling you that something is wrong. So it depends on what is really wrong in this scenario. For example, if you have glaucoma, and as a result of the glaucoma you're having night blindness, that means if you don't attend to it, we have already seen that you can lose your vision. And then if you have vitamin A deficiency, well, until you fix the vitamin A deficiency, you're never going to have your night vision back. So you need to fix that as well. If you have cataract, the same thing basically. So you want to just simply check your eyes. Check your eyes.
What I've noted in the conversation, check your eyes, please, viewers. Also, as we come to the conclusion of the program, could you kind of give your conclusion remarks to the viewers who have been with us as we conclude?
But as you might have heard, throughout all these conditions, all these sessions, the biggest thing I've repeated is please visit the eye doctor, check your eyes in case of any issue. Even if there is no issue, just visit the eye doctor, have your eyes checked, because like you've seen, some of these conditions have no signs or symptoms. sometimes. You will never know until it's too late. By the time it's too late, you've lost 50%, 60% of your vision. And we end up just trying to preserve that little one, which is really, really not good. So please have your eyes checked regularly. Visit us here at MedOptics Vision Center. We are located in Arua City, opposite Bank of Africa. Very, very accessible. Come by and we shall be able to assess your eyes and then basically maintain your eye vision.
Thank you very much, Dr. Benjamin, and also our viewers who have been with us from the hour of 11 a.m. up to the conclusion of the program. I've been your host, Sunday Junior Tom, together with Sophie, the producer behind the camera. Thank you very much. Till we meet again next week on Thursday, same time, 11 to noon. Thank you.
West Nile TV, lighting up the region.
Ekiki nsasula emyezi 3 n'empangula.
Abayo kubadde ki?
Kituufu wensasula emyezi 3 mpangula. Kituufu.
Subscribe for 3 months to any package of your choice or grab an Azam TV kit and pay for 3 months and stand a chance